AIDS. AIDS. AIDS is an abbreviation of the word Acquired Immune Deficiency Syndrome. It is caused by the virus HIV. AIDS is a disease of disorder of the body's immune system. Immunity is body's natural resistance to fight against germs and resist diseases. AIDS virus also attacks brain cells, causing a loss of mental abilities. The virus is passed from one person to another through blood to blood and sexual contact. Infected pregnant women can pass HIV to their babies during pregnancy, delivering the baby during childbirth. Both the virus and the syndrome are often referred to together as HIV/AIDS. People with HIV have what is called HIV infection. The development of numerous opportunistic infections in an AIDS patient can ultimately lead to death. What is the difference between HIV and AIDS? HIV is the virus which attacks the T cells in the immune system. AIDS is the syndrome which appears in advanced stages of HIV infection. HIV is a virus. AIDS is a medical condition. HIV infection causes AIDS to develop. The HIV infection is allowed to progress and eventually it will develop into AIDS in the vast majority of cases. Signs and symptoms. Many people with HIV have no symptoms for several years. Others may develop symptoms similar to flu, usually 2 to 6 weeks after catching the virus. The symptoms can last up to 4 weeks. Symptoms of early HIV infection may include fever, chills, joint pain, muscle ache, sore throat, sweats, particularly at night, enlarged glands. Causes. HIV is a retrovirus that infects the vital organs of the human immune system. The virus progresses in the absence of antiretroviral therapy. The rate of virus progression varies, depends on many factors: age of the patient, body's ability to defend against HIV, access to health care, existence of coexisting infections, the infected person's genetic inheritance, resistance to certain strains of HIV. HIV can be transmitted through sexual transmission, perinatal transmission. The mother can pass the infection on to her child during childbirth, pregnancy, blood transmission. The risk of transmitting HIV through blood transfusion. Prevention of AIDS. If you are an injecting drug user, then do not share needles or other injecting equipment. If you think they have been exposed to HIV through sharing needles or sexual contact, you should contact your GP or a sexual health clinic as soon as possible. If you are pregnant and have HIV infection, then you need special antenatal care to reduce the risk of passing on the virus to your baby.